Hi everyone, my name is Juwaria Brown. I'll be talking about the impact of COVID-19 on the Global Polio Eradication Initiative in Pakistan and Afghanistan. So before I get into my own findings, I'll just go briefly into the literature review and the sources that I'll be using. The first field or area that I want to look at in terms of research is just establishing some background on polio. So polio is a viral disease. It's an illness that children are prone to getting, and we're really close to eradicating it from the world. And so we can divide the global effort to eradicate polio into three distinct phases. So the first is from 1988 to the end of 2000, and then 2001 to the early 2010s, and then right now we are in the third phase from 2011 to present. And a lot of scholarly research has concluded that the most effective way to eradicate polio is through mass global vaccination programs. And that's what the Global Polio Eradication Initiative has been doing. They're using mass global vaccination to rid the world of polio. And the Global Polio Eradication Initiative is a public-private partnership. They're made up of 6 organizations: the World Health Organization, the US CDC, UNICEF, Rotary International, the Bill and Melinda Gates Foundation, and the Global Alliance for Vaccines and Immunizations. And as of 2020, there were only 2 countries where polio was still endemic, and those 2 are Pakistan and Afghanistan. And endemic just means that cases still occur every year. Okay, so more of the previous research. So some background on the 2 countries that I'll be looking at. So Pakistan is the most populous and yet the least developed country in the World Health Organization's Eastern Mediterranean region. The population is there for you. It's about 216 million. And then I also have a couple of stats here. So 24.7 million children are under 5 years old, and 66.2 million children are under 15 years old. And the population of Afghanistan is almost 39 million. We have over 5 million children who are under the age of 5, and over 10 million children that are under 15 years old. The reason why I have these stats on the ages of the children is because polio is one of those diseases where you have to vaccinate people when they are young, when they're children. That's when you protect them against polio. Otherwise, if you miss that range, then a person's not vaccinated and is vulnerable to contracting polio. And children are very vulnerable because it sets them up for life. If they get the illness, they can get disabilities. Their brain and spinal cord is affected. So that's why I have those stats there, so you can see how many children are in both of these countries and why it's so important to make sure that they all get vaccinated. I've got a list here of all of the factors that are complicating the polio eradication initiative. Pakistan and Afghanistan are 2 tricky countries because there's just so many challenges. The terrain can be difficult in some rural areas for health workers to cross. Violence also limits access of health workers. Cultural and religious factors are at play. There's a lot of vaccine hesitancy and rise of vaccine resistance. In populations, people don't want to get vaccinated. There's inaccurate media messaging, unmonitored border movement because these 2 countries border each other, and security issues due to terrorism. How does COVID-19 play into all of this? So the Polio Eradication Initiative has been going on for decades, and we were really close to stamping out the disease, and then COVID-19 happened. So in 2020, all polio vaccination campaigns came to a halt in both of these countries for at least the first half of the year. And in general, COVID-19 has forced all countries to redirect their health resources and human workforce. And Pakistan and Afghanistan are no different. Now, this is problematic because in the past, polio has spread to regions where cases did not occur after vaccination was paused in Nigeria. So it's really concerning that the vaccination campaigns have stopped. Now, safely restarting that vaccination is very crucial to protecting the population from the spread of polio. So here are my 3 research questions that I will be arguing and answering in my paper. I won't go into them, but my primary argument is going to answer these. So first, I'm going to argue that COVID-19 has negatively impacted the global effort to eradicate polio, and global health entities have been working at responding to polio during the pandemic, but the efforts have definitely been significantly less than they were before. And lastly, I argue that global health entities need to restart polio eradication to its full capacity while safely adhering to COVID-19 protocol. So I have not completed my empirical analysis, but I have here a kind of main overview of what I've found so far and what I plan to use to support my arguments. So I have a little bit of a comparison here for you to look at. So Afghanistan, in terms of looking at, what I basically wanted to do was look at where is the polio response right now in 2021? What can I find on different websites from the Afghanistan's government, from their Ministry of Public Health, and from the GPEI that I mentioned earlier, that big conglomerate of 6 organizations? What are they currently putting out about polio? So in Afghanistan, we have a 2020 National Emergency Action Plan for polio eradication. And that's a good sign. That means that before the pandemic, Afghanistan really had polio on their radar to address. However, that plan was probably published in like 2019, so I have not seen a plan for 2021, and that's probably because COVID-19 has taken away that focus. Their Ministry of Public Health had their last polio update on their website, almost 2 years ago in 2019, so that's also concerning because I haven't seen any new updates. I'm going to keep monitoring that. And then the GPEI webpage, they have some more recent data, so you can look at that there. It says here that only 1 case was reported in 2021. However, that's probably not accurate because COVID-19 has taken away the focus, so reporting is probably not where it should be. I'll also be monitoring the polio snapshots that the World Health Organization and GPEI put out. For Pakistan, it's a similar story. They have an action plan in place, but that's from last year. And then one thing I noticed was that Pakistan has a website for COVID-19 updates, and it's a really good website actually. It's very up to date, has cool graphics and statistics, and it monitors cases and testing. And it's concerning to me that that technology is there, the government's using it, and I would like to see it being used for polio as well. And then similarly, there's a webpage on GPEI that I'm also monitoring for updates on polio. So my tentative conclusion is going to be basically that Pakistan and Afghanistan are focusing their resources and efforts into the COVID-19 response. And of course, this is absolutely necessary, but it also means that attention is taken away from polio, which is still a real global health threat. And I want to argue that the GPEI should work with the national governments of these 2 countries to make sure that polio vaccination and education campaigns resume to full capacity while adhering to COVID-19 safety protocol. Here are my references, and I am happy to take your comments in the comment section. Thank you.